Thank you. So I will get started. Aging. Aging, something no one likes to talk about, of course, but everything we have to confront with it. And in Asia, we actually do quite a good job of it. We live very long. So the World Bank put out in a recent report the top countries or territories with the top life expectancy. Asia occupies top 4. We'll be glad to know actually Hong Kong occupies the top position in that. And China has also made great strides in improving life expectancy as well. However, now that we've done a good job living long, the next step is really understanding how we live better lives. Economist Impact recently put out a report looking at perceptions of health span. So it's life lived in good years, not just the number of years. And they found that people not only want to live longer lives, but of course, better lives. They want to condense down the part where it's not so good into the last stages of life. And a big part of that conversation is going to be how technology does that for us. So in the longevity space, we see an increasing amount of technologies in that, and we have a panel today to discuss that. It's quite a stacked panel, so I have to get my notes out because everyone has a lot of qualifications. And so on my farthest side here, Dr. Tony Wu, PhD graduate from HKU in machine learning and intelligent computation. Previously, he worked at Tencent, also held an assistant professorship at Sun Yat-sen University, and focused on sensor and electronics miniaturization. He's currently the co-founder and CEO of Nineovo Technology and RingConn. It's a wearable ring device, and I'll have him talk more about that. To his right, Dr. Christine Huang, scientific physician and biotech entrepreneur. She trained as a neurologist, then decided to transition to laboratory technologies with clinical applications. Listed as Forbes China's 30 under 30 in healthcare and science in 2020, a fellow of the Royal Society of Medicine in the UK, and the board for Winghua Charity Foundation of Hong Kong. She is also a senior research associate at the University of Hong Kong. Currently today, she is a founder of Quantum Life, which focuses on genomic medicine and translating that into a clinical setting. Closest to me here, Jacky Liu. Started as an acute physician in the UK's NHS with a decade of experience, but now is one of the founding members of Bowtie Insurance and is its chief medical officer. He focuses on partnerships with healthcare providers, development of customer-centric solutions, as well as has a passion in preventive care. He hopes that Bowtie, his company, can be a thought leader in the insurance industry. And I'm Jason Yin, moderating today. I'm from Economist Impact. We are the think tank arm of the Economist Group. Some of you might know the magazine. And so I just want to set some ground rules today. The session will be 45 minutes, and I'll try to keep that to 35 minutes for the panel discussion and 10 minutes for the question and answers. And I understand that we are the last thing standing between us and lunch, or sitting rather, so I'll try to make this fun and light. All right? Thank you everyone for coming today. So I think we'll start off with a basic question, kind of introducing your company and what it is exactly that you do, so the audience can get a better idea. We'll start at the far end of the panel. Tony?
Okay. Thank you, Jason. So very nice to see you. I'm Tony Wu. I'm from the RingConn, and what we are doing is the RingConn Smart Ring, which is what I wear now. So the smart ring, which is a new type of smart wearable, so people may not be aware of this very well, but we are doing this. So why we do this kind of new type of smart wearable is because of 3 reasons. The first reason is then the smart wearable, the smart ring can be used in 24/7 because most people want to monitor their health condition during sleep. So the ring is better for wearer because it's more comfortable. The second reason is then, so we have better signal quality here, so we can get better vital signs like the blood oxygen and other medical grade vitals. The third thing is then, so we are working on a software that can give some more AI coach and AI health advice to the people. So because of the large language model, so we can do more service than the smart watch brands. So our company now is already sell the product for 2 years, and we have more than 100,000 users all over the world. And if you check YouTube and Google, so you search RingConn, which means Ring connect everything, connect health, connect your lifestyle. So you can very easily to find the review of the smart ring, and we think then we can provide a good result to the people to monitor their health and promote the longevity. Thank you.
All right, thank you. And we'll just move down the line. So Christine.
Thank you so much for having me here. Thank you, Jason, for your wonderful introduction. And it's my great pleasure to be a panelist in this amazing discussion. I'm Christine. I'm the founder and CEO of Quantum Life. One thing today I'm super excited that is we are putting longevity technology into the Asia Healthcare Innovation Summit. Because I've been working in longevity technology field for over 6 years. And majorly we're seeing the trend is happening in the States and in Asia, maybe Singapore, but in Hong Kong as the longest lifespan, and those group of people were really cares about our life, quality of life. Rarely we'll talk about what is longevity technology. So thank you, Tony, for introducing the smart ring. I have been using a smart ring, but I want to try yours, right? For measuring my my sleep for over 4 years, and that is one of the excited data source for what is Quantum Life is doing. Previously, we are considering medicine. We only consider disease and pathological diagnostics. I was trained as a medical doctor. We never think about, especially in Western medicine, we never think about how we can use the data accumulated by human beings itself to develop preventative intervention. It's rarely happened. But during the past few years, the genome medicine, early detection happened, liquid biopsy technology being introduced. We do have much power to develop preventative window for major human beings, just to how. That is how longevity medical field popping up during COVID, actually. And during COVID, I just mentioned to Jason, almost each year, 800 longevity clinic happened, showing up, booming up in the United States. And now this year is booming up because of after COVID, more and more people are super curious about their health condition. Then Quantum Life is an integrated platform to using private computing, computer analysis, combining molecular data and also wearable data and also medical records to set up the standard to provide a standard measurement and a standard protocol to those longevity clinics, and to empower no matter medical physicians and also and also healthcare providers to have a chance to bring health closer to their patients.
Thank you, Christine. And we'll round it off with Jacky.
Hi, everyone. Thanks for Brinc for inviting me, and I'm excited to share about Bowtie and my thoughts on the topic as well. So a little bit about Bowtie. We were the first virtual insurance company since 2017. And the reason why the insurance authority thought it was necessary for them to issue the new license and gave it to us and 3 other companies was the fact that they noticed the insurance market was booming then and still growing at a healthy rate. But if we look at where the insurance premium are going towards, a lot of it is going towards perhaps investment products, but where it's really needed, the protection gap, the leverage, the peer protection insurance, that wasn't really growing as much as we wanted it to be. And hence, we were tasked with the mandate to try on a different channel. So what we do is we sell peer protection online. And what we have achieved in the last couple of years is we have been consistently growing the market. So the percentage of insurance directly sold, if we look at the premium numbers, went from 3% when we started to around 10% now in the market. And within that portion, we Bowtie are number one, and we kind of contribute 40% of that. We're proud to call ourselves top 10 insurers in terms of the policies issued now. That has been recently happened in the last quarter, and we hope to become a top-of-mind health insurer in the future. How we different from traditional insurance company per se, I think is threefold. I think first of all is, as I mentioned, the way that we distribute the insurance policies. I think we don't necessarily, we are competitors, but in a sense, like I think we target a different segment of customers that previously were neglected. So I think what we try to do really at Bowtie is to increase the insurance penetration. And secondly, I think it's how we leverage our tech to make it more efficient to serve our customers. And I think third is our health focus. We consider ourselves a health insurer before as a life insurer, not a life insurer. So what kind of health services that we offer to our customers to make them healthier in the long run instead of just financially reimbursing them is what we're really focusing on. So sort of really echo with what Christine said, not wait until they get sick, but perhaps how do we preemptively detect they are sick and perhaps prevent them from getting sick. As for myself personally, I was a physician previously as well, and at Bowtie I try to work with different parties within the industry, outside the industry, to fulfill our vision. So yeah, thank you very much for having me.
And so I want to bring it back to the title. We're calling it Smart Aging, so the role of technology on longevity. And maybe, perhaps Jacky or Christine touched upon this, but I want to think about, okay, well, how are these technologies that are represented on stage really related to longevity? Perhaps with Christine's technology, it's a bit more direct, but maybe we can start with Tony over there. In terms of these smart wearables, of which the Ring is one variety, perhaps how is that relating to longevity? How is it maybe changing the discussion of longevity?
Okay, thank you. If we recall the development of smart wearable, how long have you been used this kind of device, smart watch or smart bands? Can you recall? So it's only less than 10 years. It's not a very long period. But if we said then in 2014, so the smart band can only monitor the steps. After then, it can monitor the heart rate, then blood oxygen, then the sleep stages, sleep times. But now the smartwatch can extend to monitor more medical disease like the heart failure, the stroke. This is development of the technology. The technology is not only the hardware or software, it's a combination. So we can say that now the hardware side, so the development of the chips, the circuits develop a lot. And also in the algorithm. Now I was a PhD student at Hong Kong U. What I study is machine learning. So when I was in 2015, the algorithm can only be used for very simple applications. But now, because of the deep learning, the transformer, so we can use algorithm to learn more hidden features in the biomedical signals. So the third part is about the data. Data is really important. So if we do not have the data, we can do nothing. If we have good data, we have good labels and ground truth, so we can do a good decision of that. So that's why we positioning our company as a health company, which means that we have the very low level data acquisition. So we acquire the raw data of our body on the finger. And then we have collaboration with hospitals and the doctors in China, in Hong Kong, and in Europe, and in the States. So we have some labels Then we work on the algorithm by ourselves. So we apply many algorithms to many different types of applications. And these applications, some of the learning models can be transferred to another disease. So which is really exciting to me. So I can focus by myself, and so the smart wearable can be used to solve more and more medical disease and medical features, and people can know more about their body condition very well. So that's my answer. Thank you.
Okay, so perhaps about along the lines of earlier disease detection as a result of more continuous monitoring as a result?
Yes, it is. So this is the most basic part. So we can have more forecast, more disease at the early stage, and also because of the large language model, as I said before. So the algorithm itself can be more like a real people. So it's not just a word. It can give you very human-like advice.
Great, thank you. And I want to go to Christine now for her technology. It's trendy now, I think, to look at aging on a more biological marker level as opposed to, well, I suppose a physical level or just your age. So can you tell me or tell the audience maybe a bit about how that technology is really changing the study of longevity and how that technology will be used perhaps to live a more enriching life?
Thank you. What we are developing that is called multi-omics technology. Give you one example. Like Tony mentioned, sleep measurement or the biological signal from wearables, that is one of the omic information. So multi-omic technology that is, as also a quote from Tony, now the infrastructure like wearables getting more and more matured. The information generated from these wearables is much more valuable to us, and how to accurately drive this information without noise and also combined information together and build up a model for you is actually the key. So what we're doing, that is, we're doing the building model part and drive the best information from life science. So that is multi-omics technology. We combined most of the information generated around, like from wearables, from traditional medical record, from the from genome, epigenome, transcriptome, and for combine them together and drive the best combination used for either aging or disease prediction and developing intervention strategy for you. So that is quantum life technology. If you generously, please Google quantum life, and we want more follower on our LinkedIn actually. Yeah, so that is how we are using artificial intelligence and introduced combined what is data accumulated previously. Now we also want to have more. We want to bring this more matured technology. It's not matured yet. It's just one step further, but that is a step from the transforming from the sick care to healthcare, and adopt that into clinic. Now, quantum life technology being adopted in Japan, in Singapore, in Switzerland, in UK, and in the States. Very soon, the next month, we're going to announce the technology adoption in Hong Kong, and hopefully more and more Hong Kong's Medicare, sick care medical center can shift a little bit to healthcare and provider, and provide to the society more and more better solutions for healthcare. And I'm so happy today together with Tony and Jack, because for that definitely impact too. I also wanted to hear how the insurance perspective on this kind of shifting. Yeah.
I think that teed him up quite well for that question. So perhaps it's interesting to have someone from insurance on this panel. And Jacky could maybe speak about how he sees, perhaps from the insurance side, how that would relate to these technologies and longevity. So stringing that together.
Thank you. I think first off, me coming from an insurance, I'm not like Christine or Tony where I've got an interesting, exciting device or some very kind of cutting edge science where I can offer to the space of longevity. But I think on a serious note, I think there is a role for insurance to participate in this. My perspective, first of all, is when we look at longevity, it can be on an individual level. I tend to focus on kind of the population level. There are different ways to kind of increase and make us all collectively healthy and live longer. And part of the way is for us to actually be treated within the medical system appropriately. And in an ideal world, all of us gets the best healthcare for free, but we all kind of know that we don't live in an ideal world. So how do we make that happen? And I think us being in Hong Kong, being in a kind of dual system, is, in my opinion, already the best. It's not the States or a totally socialized medicine. So in my mind, and the mission of Bowtie is how do we as an insurer play our part to actually effectively allow each citizen to enter in the most ideal healthcare space. So I spoke about the insurance adoption. At the moment, only still 30-something% of Hong Kong citizens have medical insurance coverage. So part of Bowtie, our mission is to leverage technology to effectively distribute affordable medical insurance. We have a whole stack of from affordable premiums with more moderate coverage to slightly higher premiums to comprehensive coverage. So we are doing our part in that. And I think it was rarely mentioned, but on this space, allow me to do this, is we, through doing our own tech in-house to actually do our policy servicing, have successfully created a company that's very efficient compared to the incumbents. I mean, if we look at the amount of employees that we have, which is 100-something at Bowtie, versus the number of premiums that we sold and versus the coverage that we actually promised to the public, the number is actually quite huge compared to some of our larger cousins who have a huge agency force and a lot less efficient at servicing their customers. So we have scalability built in our part. And I think secondly, aside from trying to help with insurance penetration, it's our focus. I think part from an insurer's perspective, historically, we sort of neglected what we talked about, which is the preventive health space and the primary care health space. So as you guys probably are aware, within the Hong Kong private market, it's all pretty much fee for service, where the health providers really just do X and then they get paid Y amount of money and no outcome is being looked at. All around the world, this issue has been looked at and probably everyone is pointing towards a solution to, we need to look at how healthcare payers reimburses healthcare providers in a more towards a value-based, performance-based fashion in the appropriate spaces. So Bowtie's technology, our digitalization, allow us to actually integrate with those who are willing to participate in this journey. So hence, we're very proud to have exclusive products signed with Nineovo Hong Kong and CHKMC, the hospitals in CHK, where we are we're able to do more value-based care for our customers. So that's the second point I want to highlight, which I think is going to be future where insurer would participate more and more. I think the third space is our commitment to primary care. I think this is another part that is neglected. Christine spoke about treatment. I think your space is very early on how to prevent someone from getting sick at all. But I think there's a space in between where we have the available infrastructure, i.e. the primary care GPs, really detecting you have suboptimal health and actually getting you to change the course or actually get it treated. No one I say, the government obviously has initiatives trying to do that. I think they are succeeding in a certain degree, but in terms of the private market, who really is trying to drive that adoption? I think we as the insurer probably are the most incentivized. So it's up to us, I think, to realize that and actually partner with the interested medical providers to kind of proceed on this field. So that's my fault. And the last point, as an insurer, I think how we relate to longevity. I think, as Christine and Tony showed on this panel, there is a lot of startups in different fields, whether it be detection, whether it be monitoring, whether it be actually solutions that could very well, it's new and it would work towards increasing our longevity. But I think part of the problem that these companies faces is how to effectively commercialize it. And I think as an insurer who is health conscious and who is trying to make our insurers live longer and live healthier, we actually have the finance and the touch points to actually partner with these companies as well. So I'll just stop there and we'll continue on the discussion. Yeah, thank you.
Can you elaborate actually a bit about that in terms of what exactly it is you look for when you're partnering with these medical technology companies? And in terms of funding them, is there something about their technology? Is there something about, what is it?
I think if it's personally what I look for, I think I'll go with this first. The most ideal in my mind, of course, is a cheap technology that applies to the healthy, not the niche. That is a solution, i.e., it immediately solves the problem instead of perhaps detect. And it's easy for the customer to understand, so very easy to have high perceived value. I think in the real world, if someone actually hits upon all those, they hit the jackpot, good luck to them, and I think they need very little assistance in actually going big. But my experience in the last 5 or 6 years in meeting various startups is, in reality, they have a couple of those, but perhaps not the full stack. And when the companies that I look to work for, the most that I find it's easiest is if they have a realization that perhaps some of those parts are missing at this very moment. It might be addressed as an MVP, but it might be addressed later. But because of those inadequacies now, how we structure the partnership perhaps would need more flexibility. I think that's one. And I think the second point I would mention is, I think there's a varying degree of realizing how easy it is that the public or layman would understood their product. So what I mean by that is, I find it much easier having a lower threshold to continue on the conversation and perhaps having something fruitful with companies who naturally have a easier to understood perceptive from the customer point of view. Because with a medical background, I have had companies which told me about their tech that I found very exciting, but it would take me about 30 minutes with about 10 to 15 slides of them over a cup of coffee for me to understand what they are about. And then I become convinced that they are really promising. But then as an insurer, when I really start to think about the next step on where do we go from here? How could I assist in helping this company to benefit my customers? I immediately run into the problem of, do I have the brainwave to capture my customers to convince them of the benefits that this company brings? And then this is often where the discussion perhaps would have cooled down by then. So companies who either have naturally a easily understood perception, or they actually figure a way to very easily explain complex cases which make my life easier, those are the easier ones to work with.
Great, thank you. And Christine, I just wanted to ask you a bit as well, because you're saying a lot of the technology that you have now is being rolled out in different clinical settings, which was the goal, right? To have the technology be translated more into the clinical setting. I just want to kind of ask about what that process looks like. Is it in hospitals, private clinics, or what is the general appetite for that from different doctors as well? Like, are they interested in this technology of genomic medicine? Are they more opposed? Do you mind talking a bit about that?
Medical doctors, they're currently now, I have to say, compared to 5 years ago, most of the physicians, especially GP, their need to learn what is longevity medicine and what is multi-omics-based, evidence-based longevity medicine. Their need to learn that. Like, compare 5 years ago, when we're talking about aging, when we're talking about aging to those physicians, especially critical American states physicians, they're like, Hong Kong is more critical actually. Yeah, so it's, what's that? It's weird. Are you anti-aging, Botox, aesthetic medicine? Actually, I'm explaining, okay, we can solve from hallmarks of aging, cellular change, aging clock, epigenetic change, blah, blah. They're like, what's that? You're weird. So then to solve that problem, we have founded a non-profit education program called Longevity Medical Degree. And we are the first longevity medicine degree have the continuous medical education credential in the United States. After that, like during 3 years, over 5,000 clinical physicians were trained by this program. And it's a free program. You can even log in like longevity.degree. You can log in and have this program, have a nice certificate. So now, like, okay, most of physicians, they gradually understand, there's a science behind. And the science is very solid. And we are gradually embody some processes happening. For example, we are all talking about 生老病死, right? If you're Asian, you definitely heard about this term. 生老病死 is a nature program. And all of the medical care, those physicians, we are physicians, we have 2 physicians trained here. What we are focusing, that is the last 2 parts, right? So we never think about, some physicians are focused on the first part, but not so many focus on middle part, because we don't think we can measure it scientifically, but now we can measure it scientifically. That is, science is also developed during the past 10 years with the evolving technology called epigenetic measurement, methylation, and we previously used that to develop cancer prediction. And a lot of liquid biopsy cancer early detection case developed through the methylation background, through the methylation technology. So, okay, and in parallel we find, okay, actually our body's methylation is DNA. We know DNA, right? The DNAs have the button, turn on and turn off. Alongside with the aging process, some are turned on, some are turned off, and that is cause aging and in parallel disease. So we develop epigenetic measurement for identify aging and disease. Then aging can be measured. As long as aging can be measured, critical medical doctors and physicians, they gradually adopting to it. Now this wave, like during the past 5 years accumulation, we can see the effect is 800 longevity clinic happening the last year in the States, and more and more and more happening this year, especially after COVID. People are so cautious about their health. They do want to know about the integrative way of the measurement of our health. Now, and in Singapore, a lot of program coming up last year, this year, and in Hong Kong. So comparing to 5 years ago, to medical doctors, they are like every day knock the door. It's like, hey, really want to understand what is the evidence-based longevity physician, evidence-based longevity technology. We measure it and we find out the solution. That is called evidence-based. And that is a differentiation between wellness and medical. And that is the fundamental part of the preventative intervention to be developed and further to be delivered to all of us. But it's a very early journey. happy to see those physicians, especially private practice physicians, shifting from the aesthetic medical part, purely aesthetic medical part, to understand what is in body, what is the overall body aging process as a trend, and also functional medical doctors top up the genetic, epigenetic, those multi-omics technology, understand more. And we hope to see through this professional healthcare providers and more credible solutions can be brought to us.
Great. I do want to open the stage to the audience because we have about 10 minutes left. And so I see a question already in the back. Could we get a microphone for them? Or this one, perhaps?
Thank you. I will have a question for Dr. Jacky Liu, because I just see your website, your company website, that you have medical training, a specialist in acute medicine. So I think you must be a doctor. I have a question on insurance related to healthcare. You mentioned that you met a lot of biotech, healthcare, medical startup, and I think your insurance companies has a lot of actuaries and other kind of insurance experts. Would you consider to provide insurance like director insurance or product liability insurance for those medical startup, healthcare startup, including the medical device company? Second, it is there's a saying that group medical insurance are losing money for most of the insurer in Hong Kong. So would Bowtie move into that sector with more cost-efficient operation to cover group medical for companies in Hong Kong? Thank you.
Thank you for the question, and I'll try to answer that in short. The first question was whether we would consider providing insurance or medical insurance to companies' directors. The answer is yes. I didn't have enough time to share this, but we are actually growing our group medical business quite well. And we don't yet have group medical insurance for companies' directors only, but we have group medical insurance for all different segments. And as a matter of fact, our primary targets are the small to medium-sized enterprises who traditional group medical insurers find it difficult to cost-effectively service. Whereas our advantage is the fact that we are a lot less hands-on dependent, let's say. And therefore, it allows us to provide cost-effective group insurance solutions to the SMEs. As a matter of fact, the smallest numbers we insure, I think if I'm not incorrect, is 2. So you have a company with 2 people, we already offer a group medical insurance. And second part of the question was, sorry, I forgot. Yeah, it's money losing. How do we see it? I think it is true that there are certain segments within the group medical space that is industry-wide money losing. But I think what I can share is those tends to be the tailor-made groups. Whereas like when we target the SMEs, we're providing a package price. We're not individually quoting a price for that individual company. And our experience is actually for these, we can actually offer a competitive price, but yet within a affordable kind of cost-effective way as well. Thank you.
Any other questions? I see one over there in the back there, and then one in the middle. So we'll take the questions together, and we'll have them answered. Microphone.
Jacky, oh, thanks. Yeah, for Jacky, I guess the question I have is, early detection is actually an important part in longevity, right? And I personally invested in cancer early detection tests in the past and try to actually roll it out with insurance companies. But actually, there's a big conflict there. I realize, because actually, insurance company doesn't want you to find out that you're sick after you buy the insurance plan. There is an inherent, huge conflict there. I don't know how you see that, and because there obviously, I think early detection and prevention it should be a huge part in healthcare and in longevity in general. And then the other question, really for Tony and Christine, there's a lot of similar technologies, or maybe not so much for quantum life, but there's a longevity clinic, etc. Then definitely a lot of rings out there as well. Could you share a little bit exactly how your technology or what you're trying to do really differentiate from the crowd, from the noise? Just share. I think it would be a great platform to share with the rest of us as well. Thank you.
Great. And the other question in the middle here. Do you mind just shouting out?
Hi, this is Xue Xiaoyu, a PhD student from the City University of Hong Kong, and I have a question for all of three guests. My question is about what factors of digital technologies are most important during the process of adoption and usage for different stakeholders, including governments, elderly peoples, and their relatives, and service providers. So what are the most important factors of digital technologies in adoption and usage? Thank you.
Great, thank you. So I think because we have questions for everyone, we'll just come down the line and I'll wrap it up afterwards. We have 3 minutes, differentiation for your technology, factors for adoption. Tony?
Okay. Even though now we have many smart wearables, but many of the device are some commercialized product. So if you want to make money, so you will use a very low cost to deliver the product. So most of the company, even at the beginning, so they usually buy hardware from one company, buy the algorithm from one company, buy their software from a company, and to put the brand here and to sell to the market, like Xiaomi at the beginning. So, but what we are doing is then, so we collect the data by ourselves. We use the very raw data, collect the data, and we apply the algorithm to the device itself, and we can know more features, and we can apply our own algorithm to the raw data. So, which is really important. And so, like I said, that we have the end-to-end from the signal side to the customer, to the user side, to the chain, so that we can have more applications and disease detection with our product and company. Yeah.
Christine?
So actually, longevity, Quantum Life, with our first product, LongevityOmics, providing we are the first company. We're the first solutions from the raw data to clinical reports, multi-omics, likewise, longevity medicine globally. So there are many fragmented parts. Some people are doing the genetic testing, some people are doing the epigenetic clocks, or some other single omic information, single omic analysis, but we're the first ever integrated platform, and automatically from raw data to deliver report, clinical level. So in this part, we are quite differentiated from others, and answering the governance issues, right? We have a second question on governance issues, right? For the governance issues, we're our way now that is we're really focusing on private care because it's a new technology, and we the public health part, we hope government will notice how the benefit from the preventative solution to overall in the future the equity, health equity, but now we are more on the private practice.
Great, and we'll round it off with Jacky with 40 seconds on disentangling the paradox of prevention and insurance.
I'll address that wonderful question on the cancer screening, if you don't mind. I think your starting question. I can see where the difficulty comes in, but if you had the perception that I think insurers are not interested to have their insured find out they've got cancer, I think that is incorrect. The reason being is, whether it be medical insurance or whether it be life insurance, we actually have interest. But I think the difficulties you encounter was whether the insurance company actually, where do they capture the value by offering the customer that cancer test? Is it just simply perceived customer value from customer engagement such that the customer think more fondly of the insurance company? I think there was where the discussion had in your experience, and that is where I think it will fall apart. I think I mentioned that Bowtie is looking for like-minded medical provider. I think similarly, you would need to look for like-minded insurer where by their design, there are ways to capture the value for a customer to detect their cancer or any other disease earlier, and thereby actually allowing them to generate some form of value, like what I shared about, like accounting for being able to actually document that our insurer is getting better, therefore factoring that saving and actually funneling it into potential service. So long story short, I think it is not a dead-end discussion, but it needs to be more constructively dialogued with the like-minded partner. That would be what I think. Yeah, thank you.
Great, thank you. So that brings us to the end of this session. I just want to thank Brinc one more time for getting everyone on this stage. As you can see, there's many different players within the longevity space, and they're all working in their own way to kind of change our approach to aging and longevity. So thank you again for all the panelists here today. Thank you, Brinc.